Hey guys, welcome to my channel. This is Z. I'm on the street again. Today my task is to ask people what they have heard about the coronavirus. Actually, my parents, they went to Wuhan, I think at the end of the December. That was when the virus was still, very under-discovered. And they have been doing okay, don't show any symptom or anything, but I'm like very worried about that. But the coronavirus has spread out the whole world. So far, there have been 8 confirmed cases in the States. And very recently, the 8th case was confirmed in Massachusetts. So my task today is to ask people on the street and ask a simple question, what they have heard about the coronavirus. I chose this question because I don't want to have any leading questions that could get people lead to the answer I want to hear. I just simply want people to open up to me and tell me what they have heard from the media. So let's do that. Thank you so much for taking this interview with us. What's your name?
My name is Eric.
I'm Mary Elizabeth.
My name is Andrea.
Hi, I'm Sherry.
My name is Valerie Brooke.
What's your name?
Erica.
Michaela.
Cesar.
I'm Michael.
I'm Chloe.
Hi, Chloe.
I'm Annie.
Hi, Annie.
My name is Juanita.
My name is Camilla.
Freddie.
The first question is, what have you heard so far about this coronavirus?
Disease started in Wuhan,
China. Yeah.
China.
8 confirmed cases in the U.S. I know that. I think
The World Health Organization named it like a global health emergency.
Yeah. What else?
They don't really know how. Is it airborne?
I think it is airborne.
And maybe it's
Pretty sure
airborne.
It's spread, and then I think it started with rats and mice, or eating snakes and mice, or snakes and bats. I think
Maybe.
That's what I heard.
But I'm not
regardless.
sure about that. I don't know if that's true. But I know it's the same, from the same disease family as the flu or the common cold. Yeah, so that's what I know.
I've heard that it's an infectious respiratory disease, that it's spread through coughing and it's spread through fecal matter, and that it is spreading pretty rapidly, but a lot like how SARS and how the regular flu spreads, and that it's more a matter of just having good hygiene practices.
Well, I've actually been reading a lot about it, and I have a lot of clients in China, and I'm a little bit scared. I'm a little bit of a hypochondriac, but I'm worried about how it's going to affect the Chinese health and also the economy, the worldwide economy, because I've heard there's over 60 million people that are in lockdown and quarantine in their homes in Wuhan and all throughout China. So I feel badly for them if they can't get out and do their shopping and their errands, and it's almost like a bad Grisham novel. But I'm concerned for the health of the Chinese and also for the American economy and the Chinese economy as well.
Coronavirus is highly contagious. It's not well understood, and 4 countries are working on the vaccine as soon as possible, because it seems like adults, particularly male, between 50 plus and 60 something, are having pneumonia, which causing them to die.
I've heard that it originated in China, right? And that the first case was found in Massachusetts, I think yesterday, and that the best way to prevent it is by washing your hands and wearing a mask.
I heard that it's a virus that had originated in China, and it's a pretty severe virus in that there's some cases found in the US, and there's also one that was recently found in Boston.
Well, I know that it started in Wuhan, China, and the city now is in lockdown. And the first case of coronavirus in Boston, it was found yesterday, that arrived in the Logan airport.
That it's bad and it's originated from China.
I heard that it is it affects people who have a weak immune system, and I don't know, similar to the flu, kind of, but worse.
I don't know. I've heard a lot, but I've heard that it came from Wuhan, China.
but I've heard that it's mostly contained there, and there have been a couple of cases in the U.S. I don't know.
Yeah, I've just been hearing about it, like on the news.
Yeah.
That it came from Wuhan, China, and that it's just like a sort of like a flu. Don't know too much about it, but I have just heard a couple of cases here in the U.S.
I heard about coronavirus on CNN. They showed it on CNN.
Any details?
No, I didn't watch. So I don't.
Okay, that's an honest answer, and I really appreciate that. From 1 to 10, how concerned you are about this virus?
Maybe a 5 or 6. I'm the same level that I'm afraid or worried about the regular flu.
About an 8 now that it's been found near I live, but before it was found here, probably like a 4.
Maybe like a 6. Yeah, like 6 or 7. I just heard that if you have a weak immune system, then it affects you, but if you don't, then you'll be fine.
Personally affecting me, like 2.
Yeah, probably like a 3.
Not at all
Not too much. I mean, I know there was a recent case confirmed in Boston, but they said that the risk was very low, so I'm not too concerned about that.
I think it's about an 8 or a 9. I think it's more important than we even know, because so little is known about the coronavirus.
So to put it into perspective, how is it compared to, for example, Ebola or SARS in 2003?
I think it's a greater risk because I have heard that the death rate is multiple. What it was for Ebola and Zika, it's rapidly spreading, and I think there's no antidote, no solution. So I'm actually more concerned than I ever was with any of this.
Not very concerned.
I can tell you are not very concerned.
I guess a 3 is. I think to me it's just like the flu or any other sickness. If you take care of yourself,
I see.
Take care of yourself.
Just to put things into perspective, how is that compared to maybe Ebola or SARS? If you
Again, I think it's very similar in the sense that the media or a lot of people are blowing it out of proportion, much more so than it needs to be. Again, if you take care of yourself and just be careful or get general checkups if you're feeling sick, then I think you should be fine.
Honestly, I'm concerned about like a 6 or a 7 because I have done a couple of researches about it that it's like not as severe as people think it is, and that people are somewhat over-exaggerating about it. I would say for me maybe a 5 or 6, only because I think all diseases should be definitely looked at, but like there have been like a lot of other, like the flu also is like, if anything, just as contagious, and the same, like a lot of more people have actually died of the flu this year than the coronavirus. So I'm not concerned, but I'm like normally concerned.
Same with me. I would say like a 3. I'm not like super worried about it. I feel like it's been pretty contained.
Like a 5. I think it can be controlled now.
And the second question is that from 1 to 10, how concerned you are about this virus?
I don't know. I eat a lot of shrimp and sardines and stuff, garlic.
Okay. You eat a lot of garlic?
Yes, garlic.
Also, like preventative.
Yes.
I see. So, in addition to that, are you going to?
But I don't know if that prevents it.
Oh, okay. So you just like eat garlic. Are you going to purchase any mask in the future and wear them?
No, I actually have a client that just arrived from China, and I already have a mask, but I don't want to embarrass her or make her feel bad, so I will just stay arm's length distance when I hand her the keys to her new apartment.
No, I think with a good personal hygiene, it's going to be good, like washing your hands every day, the alcohol with your hands.
Probably not anytime soon. No, I don't think so.
No.
Until there are more cases, I don't think it's really worth it.
Also, I just don't know how effective masks are.
Yeah, also true.
Like, is it worth it?
No.
Can I ask why?
Because I think that purchasing masks is more a part of public hysteria, and that by washing hands and by covering your mouth when you cough and not going out when you're sick, I think that's pretty much really it. And that the type of mask you would need is a pretty high-tech mask, not a regular mask.
Yes, I'm planning on purchasing that soon.
Are you going to wear a mask? And
I don't think I am.
you are not?
No.
Any reason why?
Because honestly, there's like other viruses around, like the flu and stuff, that are also pretty severe, and no one wears masks for that. So for another virus that people are like just hearing about, it's like there's no point on wearing one.
No, I don't think I'm going to.
No. It's too much?
Yeah.
Yeah. Then the third question is that I guess you're not, but are you going to wear the mask or not?
Nah.
Yeah, just take the hygiene. Okay, thank you so much.
No problem.